So the first term on our list is aspiration. This is a fancy SLP and medical term for choking. It's when something that's supposed to be going down your esophagus goes down your trachea and it doesn't belong there, which can cause it to get into your lungs. And so we call that aspiration. The second term is bolus. That's what we call the food or liquid that is in your mouth as it moves through your body, through your esophagus and through your oral mechanisms. We call that the bolus. Okay, it's the food and water that you're eating. The third word is dysarthria. That's basically any type of muscle weakness that would cause the swallowing to be impaired. It could also cause impairment of speaking. Okay, next word is dysphagia. That is our term for swallowing disorders. If there's any type of an issue with swallowing, we call that dysphagia. And then there's different types of dysphagia, but it's the basic term. Modified barium swallow study. This is when we send a patient to get a video x-ray done, and it shows us on x-ray their swallowing mechanisms, and it shows us after the bolus leaves the oral cavity and it moves through the pharynx, what's happening to it, and where is the breakdown occurring, okay? Which obviously you can't see because we have our skin and you can't just look through that. So it allows us to basically use that x-ray to look through and see what's going on. Okay, the next one is a bedside swallow evaluation. These are very common and they're very important because it's the first step to getting somebody basically the help that they need with their swallowing disorder. This is when a speech therapist will come and they will test the strength of the tongue. They'll watch and feel the person swallow. And so we judge as best we can what's happening without being able to see anything. And so that's our first kind of this part of seeing if there's a problem that needs to be further addressed. Okay, silent aspiration. This is when you aspirate on something but you're not coughing, or the person isn't coughing, they're not showing any signs that something's wrong, but it still is wrong, and the bolus is part of it, at least, is still going into the trachea and then eventually moving into the lungs, but they're not showing any signs or symptoms of that choking. So we call that silent aspiration. And then the final one is compensatory strategies. These are strategies that we teach people when they are, when we have diagnosed them with a swallowing disorder, with dysphagia, and we're saying, okay, here's what they can do to improve this and stay on the consistencies that they want to eat. So by doing these compensatory strategies, oftentimes people don't have to stay on thickened liquids. They don't have to have a modified diet. Sometimes they'll have it for a brief time while we're teaching them those strategies, but if they can learn to use those strategies, it can prevent and eliminate aspiration. So those are the main terms that are good for you to know.